I just wanted to ask a question around partnerships, and because if I could give an example, in Newcastle in New South Wales, the Awabakal Aboriginal Health Service there decided that it would do a lot of work in pushing the University of Newcastle to graduate a cohort of doctors. And they got right behind to push that university along to graduate doctors, and a cohort, you know, so I think about 10 in the first intake. But I think that relationship between the Vice-Chancellor and the head of the School of Medicine and the Awabakal Aboriginal Health Service was a really important partnership in moving things along. And so I just wondered if any such partnerships exist here, or that are they beginning, or anything like that.
I think the partnerships are beginning. I think that they're not all quite there yet. So certainly we see examples such as Dr. Evan Adams and his role with the Faculty of Family Medicine at UBC. We have an increase in the commitment from post-secondary institutions across the province of BC, and many of them are bringing on Aboriginal advisors, such as Nathan Matthew at TRU. We're seeing an increased focus from our faculties of nursing within most of our post-secondary institutions here in British Columbia. And then within Interior Health, George Gerard, our Aboriginal Human Resource Consultant, has been working very hard to help to create an Aboriginal Human Resource Plan for the Health Authority. He recently was instrumental in the September board meeting of our Health Authority and having a policy on diversity and a policy in Aboriginal workforce participation passed by our board of directors, and that's never existed before within a government health authority in terms of their commitment to the concepts of diversity and Aboriginal workforce participation. So I think that we're at the very beginning baby steps, but we are fortunate that people have a political will to listen.
Does anybody want to add to that?
I know on behalf of the Métis community, the Okanagan, or the Interior, we're also looking at, again, viable partnerships with all partners. So again, with Interior Health, how we can work together in certain areas of health, you know, where we might have services or they might have services that we can do linkages with. In terms of the University of Okanagan, again, how they can maybe help us to acquire the data and research that we need in identifying the health needs of Métis communities in the interior. And of course, partnering with other Aboriginal groups and things like that. Again, we always extend the olive branch and hoping that we can formally get partnerships with them and move forward.
Okay, any more questions or comments?
Good afternoon. I work for the BC Ambulance Service. This is the first time I've heard of cultural safety. Cultural safety in the BC Ambulance Service. Now that's almost an oxymoron. But it is fun. To me, I do it because to me it's play. And I would like to see more of the Native peoples get into the ambulance service, and it's really, really hard to attract them to the ambulance service. It is a lot of fun, like I said. It is. I'm a welder by trade. I can make 3 times the money doing that, but it is not as much fun. Some of the things like talking about cultural safety, there's a very large community down the lower mainland where the BC Ambulance Service won't go to the reserve unless the police are there. You know, that's quite common in the BC Ambulance Service. You know, so if somebody's sick or dying on the reserve, you're out of luck if there's no police present. And that's one of the reasons I'd like to see way more. There's very few Native paramedics in the ambulance service, and we need more, and I'd like to see if some of you people could go back and encourage the young people to get into it. It's difficult, it's not easy, but once you get into it, it's very rewarding and a lot of fun. That's all I wanted to say. Thank you.
So is cultural safety an issue in welding?
Not really. Not really, no.
Okay. Any more questions, comments?
Good afternoon, everyone. I just wanted to make a comment, and I really appreciate the organizers, and the ONA is one of them, that events like these are happening, and they're too far and few in between. We need more. I've been involved in community development probably most of my career. In the last 5 years, I've been with the Aboriginal People's Family Accord, and that's about partnerships. And I think one of the difficult things, and Evan spoke to it very well, is how we as Aboriginal people hurt each other in that way. We don't trust. We build our territories, and we stick to them very closely. That includes our bands, our friendship centers, our Métis agencies, all of us. We all do that. We get afraid to trust. And I think that if we're ever going to grow and move forward, it's listening to educators like Dr. Jennifer. And I'm sorry I forgot your name. And I really appreciate the wisdom that you've shared with us today, because it's going to take many, many meetings like this. I've always believed in meeting and feeding the people, and they met and fed us very well today. And thank you for the cooks. They were very wonderful. But again, one of the things that we address, and it's very, very difficult when you're moving into putting programs together or an organization of partnerships, one of the things we really struggle with is the silos. We, even within the Aboriginal People's Family Accord, when we started putting together the mental health wellness workers and the early childhood development, all of a sudden they were going off on their own, and I'm thinking, we need to be a team. We've got table coordinators out there. And because I always say we're in a system that's not ours. It's not of our making. And we continue to follow that system. And I've always asked, when I'm out in communities, I ask them, how are we going to do this? I don't know how. I don't have the answers. But I look to the communities to say, how are we going to do this? And one of the ways is with trust. And I ask that from the bottom of my heart every time, that we have to learn to trust one another. Otherwise, we're going to, instead of the 1 or 2 steps forward we make, it's difficult enough working against this uphill bureaucracy that we call government. Whether it's the health system or the Ministry of Children and Families or forestry or whatever it is, they are systems that aren't ours. So we do need to create our own. Thank you.
Can I ask a question?
My question is for Dr. Diane Weepa. One thing that we have identified over and over again, and it's part of our Aboriginal Health and Wellness Plan, is that we need more of our people to be service providers, to be in the healthcare field, to be in the education field. However, we are not part of the dominant group in any of those things. So how can we, I guess, prove to our young people that they are going to be culturally safe, and that if they would participate and get the education, then they're going to be able to increase that cultural safety?
That's a big question. All I can say is that I just reflect on my own children, 7 and 12, and in New Zealand we have Māori language immersion schools, and our children are 10 times more fluent in Māori language than we are, and my husband and I. And what we find in that sort of schooling system is that the self-esteem is really high for the students, that the children that go through that system from preschool through to primary school, and they can go through to high school as well. They're still at primary. And it's really, I guess, having them have their own self-esteem and not being ashamed of who they are and thinking they're a second-class citizen and all those sorts of things, to really encourage and support them through that. And what tends to happen, the research I've looked at, is that children that have come through that system, I wouldn't use the word arrogant, but they seem to have this high level of self-esteem, and it really does show through when you compare them perhaps to their peers that are in the mainstream schools. So I think it starts at home, all that sort of thing of having them acknowledge and learn their own culture and being proud of it. I think it has to start at home first. But in terms of government and all those sorts of organisations, I think we need our allies that aren't Aboriginal in those organisations, such as my friend sitting next to me here. And I guess it's because we can't do the fight on our own, and it's really finding champions, allies. And I don't think you even need lots of people to be on the same journey with you. I think just a small group of people is all you need, like today's symposium. I'm not sure how many people exactly were involved, but the organising committee, had an idea, and it just kind of went from there. And I think that's how you get social change, just through connecting with on a local level with key people that you must know are in government. I don't know, would that be you? You may want to answer this as well. But yeah, it does take time, yeah, for sure. Yeah.
Thank you. Gosh, I'm a bureaucrat. I think that the other answer to the question is that I think if young people see government workers who are highly placed, or if they see professors who are Aboriginal who are highly placed in the system, then they know it's that is their system as well. That the government, the government of British Columbia should have Aboriginal workers there, or Aboriginal leaders there. And you see lots of PhDs here, and lots of people who are working, who are Aboriginal, who are teaching now, and that's the way it should be. Because you can have admissions, but really you need pre-admissions, and you need bridging and laddering programs, and you need retention. Like once they're admitted, you need to help them out so that they can stay, and you need professorship to lead and to add significantly to the curriculum. And I have my bannock here. In case anyone wanted to be controversial, I could bannock slap them. I'm like ready to go. So if any of you want to start fighting, let's start. Kidding. Any other questions? Fry bread power. Eh? Come on.
I'll just make one little comment about that. One of the powers of being in the community is that we do have the opportunity to mentor and take in students for the summer, and one of my goals is to replace myself. And what we've done during the summer is hire summer students, some just still in high school, and my goal is to convince them that they need to be a nurse. However, the last couple, I had one who went into early childhood development. Well, that's okay, and another, so some other professions. But I think if we start young and get them in our door and show them what we do and how rewarding it is and how able they are to do it, then we can inspire them to, because we're in competition, right, for carpenters and welders and all sorts of things. So I think we can start right at the community level and young, inspire them.
I just got a really quick little story that I often tell students about the sorts of things that make up health promotion and what counts. And it's about a woman that I met who's a health worker in Port Augusta. Well, she was a health worker there, and she was running a program that she based on another Aboriginal man's work that he was doing with young men or young teenagers. And so she was running a similar course with young teenage women, and it was on sexual health because it was part of her practitioner course that she had to do this thing and run peer education to see if a group of girls would actually become peer educators on sexual health. So he had all these table of different models in relation to sexual health, and so the first, when she started, they wouldn't look at the table, and they said, and after a while they said, "Oh, shame, Auntie." So they made her put a sheet over the top of the models of these different anatomical parts, and but she was trying to persevere, but the numbers kept dropping away. So she rang up the chief executive officer of the organisation, the sexual health. I'm on the council of this particular organisation, but anyway, she rang the council up, and the woman there said, "What should I do? They're just starting to drop away. No one's going to come." And she said, "Well, why don't you take them, see if they'd like to go to the Tanya Powell Modelling Academy." So I'm just saying that's what she did, and she said, and the whole project just turned right around. That those girls came out, those young women came out of that modelling academy, they had all this confidence, and then they started writing plays about sexual health and good ways to maintain, sexual health and good relationships. And they started performing at conferences, and instead of it being an 8-week project, it went on for 10 months. She said, "I didn't know when they were going to stop." So I give that example, but I followed it up about 3 years later. I bumped into her in Port Augusta in South Australia, which is a regional part of South Australia. And I said, I tell the story because we've got it on video. I said, I show that bit of the video and tell them, And she said, well, do you know, she said, every one of those girls has got a job. And in Port Augusta, which is an incredibly racist town, I have to tell you, to have a job there. And so I add that now to the story. And then I saw her about 2 weeks ago again, and she said, yes, and one of those girls, one of those young women who came from a really hard family, both the parents were drinkers, she said she has just bought herself her own, she's got a really good job, and she's bought herself her own car in cash. So I just want to say, where the resources from the health system need to be about holistic health. They need to really focus on that.
Okay, the microphone's over here. As usual, I don't think I have a question. I just have a comment. It's a shout out, I think, to the two representatives on the panel who are from friendship centres, because I think in any given Aboriginal community, 50 to 70% of our families live off reserve. So I think cultural safety or cultural competence comes into play even more for our young Aboriginal families who aren't living with their families and living on their traditional territory. And I think I honour friendship centres because recently in British Columbia, we've had this new term called hook and hub. It's just something that's been promoted for the last couple of years. But I think friendship centres have been hooks and hubs for our Aboriginal families for many years who live off reserve. So that's my shout out and thanks. And I think my comment about retention and recruitment in the health field, I just, as an Aboriginal infant development consultant who does home visits and works with children who need occupational therapists, physiotherapists, speech and language pathologists, that we should try to promote those careers as well, that field. So they might not want to work in childcare, early childhood development, but there's a need for Aboriginal people across the different early intervention therapies as well. And recently, there's been discussion about funding for mainstream programs and Aboriginal programs, and that it's a duplication of service, and why do you need your own, and those kinds of things. So I've come to calling it a multiplication of services, not a duplication of services, because we're multiplying our services to families in BC, whether they're Aboriginal or non-Aboriginal, because we're helping the wait lists and the mainstream programs as well. And somebody from the interior region, actually, who works with the mainstream IDP program, coined the phrase sister programs. So we have AIDP and we have IDP, and we see ourselves as sister programs, then that takes away the us and them. So I think, again, that sort of plays towards that collaboration, that working together, and cultural safety for the families we work with. So I think this has been a great learning for me today to hear this from the interior region. So thank you, everyone.
When we were fighting to get some extra resources for the Aboriginal Medical Service, one of the bureaucrats, non-Indigenous bureaucrats advising the Minister for Health, said to me, "Oh, but don't you think that your services are a duplication? And also, couldn't they be likened to apartheid?" And I said, well, actually, they're the very opposite of apartheid. It's about people taking back control of their lives. But when I mentioned it to another administrator from a health service out of Sydney, he said, well, you should say to them, Jen, who's duplicating whom? So I just thought I'd share that.
And just from a Métis perspective too, because a large population of the Métis live off reserve, they live in an urban environment. So while we see a lot of Pan-Aboriginal approach and First Nation programs and things like that, there's no Métis specific services. And so that's something that we've been constantly, fighting uphill too, saying, look, we have our own cultural identity, we have our own cultures. There's a way that our population likes to be interacted with, and it's our charter communities and our service centers that are seeing that and saying, from the community, the comments, can you please get more services? We want to see Métis specific services. So again, I agree with everything that's being said. So.
Sorry. I'm just going to put this out there. I think until we start addressing poverty, education, housing, none of our health status indicators are going to change. And so I'm just going to put out there, what role can a health authority, a healthcare system play in perhaps having that standing committee on a position paper in regards to housing and taking that to all levels. So I mean, it's so much bigger than the healthcare system itself, but those are just things to think about.
My question is for Dr. Adams. To the best of your knowledge, is anyone working to amend the Health Professions Act to include reference to cultural safety?
Unfortunately, no. I don't know of any kind of initiatives in that area. Does anyone else? Cultural competencies? No. Cultural safety? No, I'm afraid not. And that one,
The College of Registered Nurses of BC, which is the licensing body for registered nurses, has a document, Competencies Required of New Graduates to Practice in BC, and cultural safety is the term that's used if it relates to culture.
Great. Yeah, yay nurses. And one of the ideas then is that you could call that any kind of legislation around cultural competency, you could call coercive as opposed to cooperative. That you are forced to comply as opposed to being asked to or cooperating with. So it is a strategy, and there are many different strategies that we could probably recommend. If we went down the line, each of us would have a few strategies about how to deal with cultural safety. And that's one, and it's an idea. But I'm really glad the nurses, and of course it's the nurses who are making these kinds of recommendations and leading for the rest of us. And it would be great to see something like that coming from the College of Physicians and Surgeons of BC.
I had one last question. Still me over here. The SOGC guidelines for healthcare professionals, is that a guideline that you'd recommend for other healthcare professionals besides physicians? Is it something that could be used as a framework, I guess is what I'm asking.
As a framework, I think it has some very good recommendations. I think they're extremely well thought out. Of course, it's not the only solution. There should be many, many different approaches, lots of different ways to skin the cat. For instance, I think the First Nations health plan, the bipartite and the tripartite health plan, has some really solid principles in them that are really cool to read. They're very pithy. They're really full of stuff for you to think about. So that's another way.
Thank you.
So, Evan, I have to tell you what one of my friends said about that expression. What's the one way to skin a cat that everyone's supposed to know about? Lots of different ways to skin a cat? What's the one way that everyone's supposed to know about? No, I'm joking. Oh, no, that was for if somebody says there's more than one way to skin a cat. That's right. Okay. Anybody else?
This is for Diane and Jenny. If you have patient navigators, can I meet with them down there and have a conference? Oh, yeah. Like soon, nice and warm?
Warmer there in Adelaide.
And I'll agree with that.
Any more questions from the floor, comments?
I want to thank the organizers for today, but also to thank some people closer to home, because I know that sometimes we can feel that social change takes place snail's pace, and it may not even be here when our grandchildren grow up, which is pretty discouraging. But I think of my own journey over the past 2.5 years of being with Interior Health, and even before that, Barbara Mack started my education, and Shauna and Judy Mace and Denise and others in this room and elsewhere have really very generously tried to help me to bridge that chasm. And I want to thank you for that and let you know what a difference you're making in our communities.
Well, maybe we've come to an end. It's been a long day, an interesting day. So I'll just end with thank yous. Thank you, firstly, to our two presenters who came from across the ocean, Jennifer Baker, Diane Weepa, and our keynote presenter, Dr. Evan Adams, and all our other panel presenters from the Okanagan area. I'd also like to thank the caterers and Michelle Smith, the coordinator for the symposium, and the funding agencies, Canadian Institutes of Health Research and Interior Health, and the partnering organizations, Interior Health, Okanagan Nation Alliance, and UBCO. And I'll just end off by mentioning that you will all be receiving information about the follow-up meeting to this symposium, which will be at UBCO on January 15th. So thank you very much.
Or New Zealand.